Every November, some 37,000 athletes crowd the streets of New York City to run the marathon. Last night, about the same number of people slept on those same streets. At least half of these homeless people suffer from severely debilitating mental illnesses, making it difficult to not only stay off the streets, but to even make sense of the world. Those fortunate enough to find their way to 34th Street in Manhattan discover there's a place to get help: St. Paul's Center.
It all started many years ago when I was a young mother, and I was one of the Brownie leaders. We were going into New York City to see something. We got off at Grand Central and we had to stop. The whole troop stopped because little Peter saw something that was upsetting him and he was crying, and there was a heap on the sidewalk there, and he said, "Why is that man there?" And then he said, "Why isn't anyone helping him?" That scene was the impetus to start St. Paul's Center.
Jean Marie had a dream that care could be provided to the chronically mentally ill in a community setting in a more effective way than it was being offered. I thought there is no reason why it can't be done.
St. Paul's Center opened its doors in 2002 with a commitment to doing whatever it takes to help the city's most vulnerable people get well.
The population that we work with are people that are down on the very bottom of our society. A man by the name of E. Fuller Torrey, who writes a lot about the chronically mentally ill homeless people, said that the situation of these homeless people is the shame of our streets, and the shame of our streets is the shame of our states.
You cannot live or work or even visit New York City without suddenly becoming aware of this problem. I mean, society has this crazy way of dealing with people. What do? We jail them, we hospitalize them.
And they never really get well. They cycle through this, I'd say, very broken mental health system that we have, and they just don't get better. And so those are the people that St. Paul's Center focuses on to help in a different way. We're a new model altogether. We consider ourselves a new model of care. We don't turn anybody away. We don't tell our patients what to do. We collaborate with them, and together we see what it is they need, and we help them get that.
Nurse practitioners bring a different perspective to the table. Nurse practitioners bring a more holistic perspective where they look at the patient in the context of his family, his community, the society at large. There's a very strong connection between the psychiatric nurse practitioner who's seeing the patient and the patient.
We see people every week, so we can watch for symptoms to develop. We also, as nurses, give wraparound care where we can connect them to other facilities. If they need housing, we help them get that. If they're interested in pursuing some kind of education or a job, once they get better, we help them with that.
Go to a place like St. Paul's Center and say, well, wait a minute, you know, you have this strength, you have this strength, and you know what? Here's another little piece of help you could get, and you know, little by little by little, it's a process.
Our focus is not the medical model focus. Our focus is not a disease focus, but it's a person focus. St. Paul's is unique. It's unique in its approach to patients. It's an accessible center for care. It's warm, it's welcoming.
When someone comes to our center for the first time, they're scared, they don't trust, they don't talk, sometimes they don't make eye contact. They're so vulnerable. We offer them a warm, inviting place where they feel respected, where they have easy access, and where they are not going to fall through the cracks. We pursue them.
Is that patient able to be maintained? Is he able to stay out of jail? Is he able to stay out of the hospital? Is he able to stay off the streets?
You'd be surprised how many people can go on to very productive and happy lives if they get the proper attention they need at the proper time.
I do think our model is working, and we have proof that our model is working because people are staying out of the hospital, which is nothing short of miraculous. We need to make a systemic change because Our mental health care system is definitely broken. And I know the city and state and the federal government are spending many, many dollars on this problem, and it's not solving the problem.
The aggregate of people's gifts always far surpasses individual gifts. When people work together, their individual talents somehow get multiplied. And I think that's what's making St. Paul's Center successful to date. That's what I think is going to make it successful and continue to be successful in the future.